My favorite suggestion, sex before you go out. Who wants to have sex when you're all full and fat after dinner anyways? So pop your Viagra mid-afternoon, have sex before you go out, then go have date night. It's so common, and it's such an important part of their personal ego, their relationship status that affects guys mentally, emotionally, and relationally if they are not getting good quality erections and being able to perform at the drop of a hat when their partner wants it. By the time they're in their 20s and 30s and they're starting to watch really hardcore porn when they are in a partnered situation, they can't get off, they can't get hard, they can't do anything. It's a big problem.
Welcome to Marriage IQ, the podcast helping you become an intelligent spouse.
I'm Heidi Hastings.
And I'm Scott Hastings. We are excited to jump right in today on this timely topic. And we have invited Dr. Stephanie Zwonitzer, a doctor of nursing practice, on the program today to discuss sexual functioning in men as they age.
Hi, thank you for having me.
Yeah, Stephanie, you've worked as a cardiac nurse, right?
Yeah, absolutely.
What got you into this realm of urology?
That's a great question because it's not what you go to kindergarten thinking you're going to do when you grow up, that's for sure. So I was job hunting and this urology job came up and I talked to some of my friends who happened to also work for the company and I said, am I going to like it? And they said, oh, with your personality, you're going to love urology. You get to have fun with patients, you get to help them. And, you know, I'm always the one who has the lovely innuendos and things at dinner conversations. I took the job and have completely fallen in love with urology and sexual medicine. It's definitely where I belong and where I have found the most gratifying sense of helping others.
Stephanie, for those who may not have a lot of experience with what urology is, can you just give a very simplified explanation of that?
Yeah, absolutely. So anything related to your bladder and your kidneys and your prostate for men. So kidney stones or kidney, bladder, prostate cancer, those kinds of things. Everything from overactive bladder and recurrent UTIs to erectile dysfunction and orgasm disorders, everything in between. So it's a very wide gamut within urology. Although at work I see mostly general urology because I work with some sex med physicians who do different surgeries in that area. That's kind of where I've been allowed to focus in and get the nitty gritty of sexual medicine with my patients.
So that's kind of your niche.
Yeah.
Great.
So we want to talk about sexual functioning in men as they age. And I think drilling down a little bit on this phenomenon of erectile dysfunction.
Yeah, it's huge. So just the facts behind it, 50% of men by age 50 have some type of erectile dysfunction, and it goes up as you guys age. So by 60, there's 60%, 80% of men have some type of erectile dysfunction.
Well, I would like to be the 20% when I'm 80. That would be freaking awesome.
Yeah.
20% don't have any problems with erectile dysfunction at age 80? Wow.
Yeah, it's pretty incredible, isn't it?
I think that you're right. Like, it's something that just happens, right? And a lot of men don't think about it. They don't talk about it. And they think that nothing's wrong, right? Or that something's wrong with them.
We want to normalize some of that today.
Absolutely, because there's a lot of shame. A lot of the guys come in. I actually have posters in my exam rooms about erectile dysfunction because it's difficult for some men to bring that up. And, you know, it's kind of like 50-50 in my practice. Some of the men don't want to see a male provider. They like to see me because they don't want to admit to another man that they're having these issues. And some men don't want to talk to me about it because I'm a woman. And so I have these posters up in my exam room so that the guys can point at it and be like, well, we're here. Can we talk about that? And it's like, yeah, we can, because it's so common and it's such an important part of their personal ego, their relationship status, all of these things that really affects guys mentally, emotionally, and relationally if they are not getting good quality erections and being able to perform at the drop of a hat when their partner wants it.
That'd be nice.
Yeah.
I wonder who gets that.
Yeah. How many times are we all in the mood at the same time, right?
Yeah, that's a unique perspective, Stephanie, that you have. I have my perspective from primary care, and I do manage that a lot too, quite frankly, in primary care. It is interesting because for all the people who are out searching for this, there's a lot more who don't. You know, they're too worried about it, nervous, embarrassed. And it's interesting too, because sometimes it appears that the wives are the beneficiary of these medications. I think for the men too, though, to just feel more confident in their ability. But I think that there's a lot more men out there who probably struggle with it. not intentionally. They don't think about it a lot. Their wives probably don't think about it a lot.
Or they may think about it a lot, very unhappy about it.
Yeah, and they don't tell them.
Yeah, I would say the vast majority of my guys, it affects them every day, all day long. They think about it constantly. They are worried about when their partner is going to want to have sex next, and are they going to get the erection? How are they going to tell them no this time? What excuse are they going to use? They don't want to admit there's a problem, because a lot of times in a heterosexual relationship, women take a man getting, or not getting, I should say, an erection, having this erectile dysfunction as a personal, he's not turned on by me. I'm doing something wrong. He doesn't want me. He's getting it somewhere else because he's not getting an erection with me. And the men don't want to give that to their partner, because almost always that's not the case, right? There are certain circumstances where that is, but a lot of times it's not. And so then they feel guilty that they're making their partner feel bad, and they don't want to have to go through that. So it's really interesting how much these guys will open up to me and say, I can't even talk to my partner about this because I don't want her to think it's her, and it's not. And I have written notes to guys and to their partners like, his ED is not your fault. Signed by Dr. Stephanie. This is not your fault. Like, these guys really are bothered by it, and they think about it a lot, and it really is consuming. And one of the things with erectile dysfunction is, I always tell my guys, it's their head-to-head connection, your brain to your penis. And if your brain is so concerned about your erectile dysfunction, am I going to get one this time? Is it going to last? Is it going to be firm enough to penetrate? All these things, they're not going to get a good erection because they're so overly focused on it that their body can't relax into it and get a good erection.
So there's a high correlation between stress and anxiety and just more severe ED.
Absolutely.
I was just sitting here thinking of that head-to-head connection being kind of like the tollway. And for women, the head to, I guess, clitoris connection is like a country road with lots of little towns.
Yeah, you got to pass through the heart for women, right?
There's no tollway. There's like little 2-lane roads through every little small town.
Men are on the freeway.
Yep.
Look, I don't want to overgeneralize here, stereotype, but that is kind of reality for the vast majority of people alive.
And it's important to state that, I think, because we don't want people to think because my husband's not like me, there's something wrong with me, or vice versa.
I think to a point, Stephanie, you say the vast majority of men, this is not an issue. There is this issue I want to just touch on quickly, not too much. I don't want to get too much into it, but so the erectile dysfunction caused by porn use, it's growing exponentially. It's still pretty minor, but with the ubiquitous availability of pornography, that is an issue. That's a problem. Erectile function or dysfunction in men who are incessantly viewing porn and masturbating.
Right. Well, and those are some of my first questions. And what's interesting is, I know we're going to talk about the more of the aging male today, but what I'm finding, and maybe you've seen this in your practice too, are the 20 and 30-year-old guys who are coming in with erectile dysfunction. And at that age, it is not physiological. You should be getting a boner when the wind blows at 20 and 30 years old. And so when you're having erectile dysfunction that young, my first question is, are you watching porn? How often? And how often are you masturbating?
Okay. Great question. Great insight on that one, because I agree. I think when I see these 25-year-olds coming, I'm like, whoa, dude, what's up? This just isn't the way physiology works.
Porn-induced erectile dysfunction.
It does happen that way if your mind is incessantly absorbed with pornography. I mean, the brain wasn't built that way to see so many different images. It's just not built that way.
Right. And when we were younger, it was, could you flip through the magazine, through the plastic cover at the grocery store, or could you find one that your uncle had under the bed or whatever? You had to work for it.
Yeah.
Now you don't. It's right there on every avenue. These kids know what year to put in for the 18-year-old whatever on these apps. So they're starting super, super young. By the time they're in their 20s and 30s, that's all they know. And they're starting to watch some like really hardcore porn that then when they are in a partnered situation, it's not the same. And they can't get off. They can't get hard. They can't do anything. It's a big problem.
So if you're in your 20s and you have this issue, men out there, and you're watching porn, we got to deal with that first before we jump into this other stuff, because
How do you do it, Stephanie?
So I kind of hit it multifactorial. So I will give them a little low dose of Cialis to give them that confidence when they are with their partner and help them get past this. But we do usually complete withdrawal from porn. I usually suggest a 2 or 3 week break from anything partnered or masturbation. And then I send them to a sex therapist because they need to work through why the addiction side of that is usually pretty strong in these guys. So we take a break, we get them the mental help that they, the therapy side that they need. And then I give them a little low dose medication to just give them that little extra confidence when they are trying to get back into partnered sex.
That's interesting. That's kind of mirrors what I've seen with sexual betrayal in married couples in more long-term relationships. But instead, at that point, they recommend a 90-day abstinence period. So maybe as you age, it takes longer periods from sexual relationships within your marriage.
Oh, okay.
And abstinence from porn.
Because in the world of Scott Hastings, it's a lifetime abstinence from porn.
Goal. Yep.
This is bad all the way around. We've done a lot of deep dives on in past episodes using scientific research, and it's a dead end on that eventually.
From our perspective, from people who want committed long-term relationships.
Scientific literature is pretty robust on that.
It's definitely depends on what the people want out of their relationship, and certainly focusing on a good quality marriage, which I know is what you guys focus on. It seems to not have a place in that.
So some people, Stephanie, say that erectile function is like a canary in the coal mine for other physiologic issues. Can you kind of go over maybe what some of those might be, maybe as a segue into other health?
Absolutely. So one of the biggest things is cardiovascular health. If you are not able to get the blood flow to your penis and you stop waking up with morning erections or middle of the night erections, there's something wrong, probably physiologically, with your cardiovascular system. Some of the other things that factor in there, diabetes, because it affects your nerves, and your nerves to your penis have to be getting the sensations to get you aroused and get that blood flow there. We see a lot with stroke patients who have had strokes can have issues depending on where in the brain your stroke was. And so there's a lot of different things that way, but I would say diabetes and heart disease are the two biggest factors that we see. And there are times where I will have, again, on the younger side of men, maybe in their late 30s, early 40s, that are coming in with significant ED. And you're like, okay, well, you're on blood pressure medicine. How are your blood sugars? And you start to work through this. And you're like, all right, you really need to go talk to your cardiologist, because there's not much I can do until we get your cardiovascular health under control and things like that. So the other thing that guys really lack on is good quality sleep. And sleep is super important for your erections for multiple reasons, but one of the biggest ones is your testosterone is produced while you sleep, and you need good testosterone for good quality erections. It's not the only factor in erections, but it's a big one. And a lot of my guys with erection issues come in and they're like, I don't sleep, I don't exercise because I'm stressed out from work and these other things. And you're like, okay, we gotta get these physiological things in play first so that we can get to the erections. You're not going to get healthy erections if you're unhealthy in general. So we need good blood flow to the penis. We need good sensory on the nervous system. And we need being able to breathe while you're having sex. There's a lot that goes into this that you need. And if your blood sugars are all over the place, your blood pressure's all over the place, you're smoking and you got COPD or something like that, all of those things are going to factor into not having good quality erections.
I remember this ad. It was very effective. It showed a cigarette that was limpy.
Yeah.
Meaning, if you smoke, then for the guys. So I tell my patients.
Yep.
All 5 of them who still smoke.
So weird when I pull up to someone at a stoplight, I'm like, you're smoking?
I know. It's like, who smokes anymore? And I ran across this. It's called low intensity pulse ultrasound. I guess kind of a new thing, new technology. I guess there's some studies behind it. It is a medicine-free approach to erectile function. Have you had some experience with that, or in what results have you seen compared to, say, Viagra, Cialis?
Yeah, it's a great question because it's very expensive and it's not covered by insurance. So I always tell my guys to make sure they do their research and really decide whether or not they want to invest in that. So what I would say is early onset ED. Maybe it takes you a little bit more stimulation than it used to get the erection. Maybe you're not as firm as you want to be, but you're still pretty much there. Real early phases of erectile dysfunction, it works pretty well for. You can get some good results. It increases the blood flow, things like that. If you're already needing some decent doses of Viagra or Cialis, it's really not going to do much for you, and you're just not going to see the results that are worth the 3, 5, 6 grand that you're going to pay to do it. The guys that I've seen it work on early onset ED, it works for 6 to 12 months. So really not that long. Some of them go and get like shorter repeat bursts of the treatment. There's studies out there that say it works really well. You got to look at who's funding those studies. But what I've seen clinically is it has to be very early stage ED, and it may or may not last long enough that makes the money worth it.
So early stage. So you said early 40s, like pretty young guys, right? If you're in there, you're 60, it's not going to be as...
Well, it depends, right? Some guys at 60 are just starting to have ED issues, and they've been fine until then. So it's really early phase in the sense that whatever your age is, you just started having ED issues.
Does it slow down the progression of it then, or you've got to expect to lay down $3,000 to $6,000 every few months?
Yeah, that's essentially what it is you're going to basically continue to repeat that process with that investment every 6 to 12 months ongoing if you want to maintain where you're at. But again, if you have any of the other comorbidities with diabetes or heart disease, high cholesterol, things like that, it's probably just not even worth your money. You're going to need to go on to stronger things, and you would be better off spending your money on working on your blood sugar, spending money on a personal trainer to get you better, get a nutritionist, things like that. That's going to get you more bang for your buck than going and getting some sound wave therapy.
Yeah, I like that.
Yeah.
That's good to know because it's out there and people are like, oh, this is what's up with this.
Yeah, the commercials sell it real hard.
Yeah, I mean, and some guys too, the side effects are so brutal from these medicines that it's like, what do I do?
Yeah, and some of them can't take it because they're on medications that interact and things like that.
So I want to kind of get back a little bit to the whole physiology too, because I think a lot of men don't understand the real physiology. And ED really is a vascular issue, right? Now, you mentioned that testosterone does help with that. And I agree to some extent. I think that's true. Testosterone is a hormone and ED is primarily a vascular issue. And so it is, I know there are guys who do come in and maybe I'm telling them wrong. I don't know. You correct me, but they want testosterone because they have ED. And I say, okay, let's talk a little bit about libido, because I know that there's the libido issue. It can help with sex drive, with that spontaneous desire. But do you put people on testosterone with just ED?
I'm very frank with them. Testosterone will absolutely help with your libido. It may or may not help with your erections. For some guys, it does because testosterone makes you create more red blood cells, so you have more blood flow. So for some guys, you do see an increase in firmness in their erections, but you are not going to go from never getting an erection to having fabulous erections with just testosterone therapy. You're going to need more than that. But it does boost a little bit of what you already have, and you may get some of the morning erections, which then you can take advantage of that you weren't getting with lower levels of testosterone. Because when your testosterone is lower, your body's just not creating that nocturnal erection like you do when you have adequate testosterone. So there's some of that you can use it to firm up the erections, but no, I'm very frank with my guys. It is not going to be the only thing that fixes. If you are coming in here not getting erections, there is more that we have to do than just testosterone.
Okay, good. That's what I say. I guess looking at it too, there's secondary effects, right? Because if you're feeling more sexy as a guy, more in the mood, it translates psychologically into other things that work better. And too, getting back to the whole, when your wife sees a very erect penis, she's going to feel more excited too, just by virtue of that.
Absolutely.
And there's a lot of psychology that goes into improving that.
Yeah, if my partner has a raging erection versus a semi-hard-on, I feel like he wants me more with that raging erection. I feel more attractive. I feel more, he thinks I'm sexy. He thinks I'm ready. So there's psychological side of it for both partners.
I was talking to Heidi this morning and I came up with a little analogy and she thought it was funny, but also a little silly. But I want to paint a picture that's accurate. And so let's say the guy, he's the delivery guy, right? And his wife is the receptionist at the office. And so she receives these packages every day, right?
Yep.
He brings it in and she takes it.
Yep.
And everything's great. Everything's good day after day. And then one day he brings in a really big box. It's a lot bigger than normal. And it's just kind of exciting for the receptionist, right? So she's never thought about it before. But now that it's there, it's like, oh, I like these big boxes now. And so I guess my point is,
Yeah, what is your point,
for
dear?
for a lot of people who don't know about this, they have this sex life that's fine. It's like the delivery guy and the receptionist. It's like, we're doing our thing. And then you introduce this new thing, and it's like, well, it's because nothing was really bad before. I mean, when do you decide, boom, right now I have ED? Like, when does that happen?
So I think it's different for everybody, right? For some of the guys, it's as soon as they're not as firm as they used to be. They're coming in and being like, what is wrong with me? I'm not as firm. I can still penetrate. I can still last until climax, but I'm not as girthy as I used to be. It doesn't get as long as it used to. Other guys are perfectly happy as long as they can penetrate, but then all of a sudden it's not even firm enough for penetration, and that's when they come in. So it really is individual as to when they feel like it's truly affecting their sex life. I think women can tell when the erection is not full and thick and when it is. You can tell when you're losing it. You're semi right now. I can't bounce like I normally do or whatever. Like, women can tell whether their partner is fully erect or not. And if you don't have a good quality relationship, I know you guys stress this in your pillars. If you don't have that good quality relationship where you're having communication, then you just go on about your day like, okay, well, that wasn't great, but whatever. I'm not going to bring it up. If you have that quality conversation and that communication style, you can say, hey babe, what's going on? I noticed that you weren't as into it today as you were. Like, is something going on where you're stressed and you're mentally at it? Or are you having some erection issues? Like, where are we at? What do we need to do? And then you can go forward with that. If it's consistently being a problem, if he's someone who masturbates, if he has that problem while masturbating and with partnered sex, that's more of a red flag that it's truly ED. If it's only happening with partnered sex, but not masturbation, then maybe we need to do some relationship thinking. Maybe I need to send them to a therapist and get in more on that side of things. Maybe things are stressful at work. You guys have a financial issue, something else that is getting in his way when he's trying to focus on that activity.
Do women go very often with their husbands to the appointments?
I would say maybe 25 to 30% of my guys have their partner come with, and I love it when they do because it is so eye-opening. And sometimes we actually get to that part of it, is that it's not really erectile dysfunction. It's more along the lines of you guys aren't connecting well, and we need to fix that part of it before we can give you, and we can still give a low-dose medicine just to help the blood flow and help, again, get them over that hump. But that's where I need someone like you to come in and help them work on the relationship side of things.
Right.
You give them a card that says Marriage IQ on it. Go listen to this and then come back.
That's great. What kind of questions do they ask, especially the women?
Yeah, they want to know if it's them or if it's their partner. Is it something they're doing or not doing that's getting their partner there? And a lot of my patients' partners want to know about the side effects of the medicine. Okay, we're going to try this medicine. How is it going to affect them? Is it really worth it? And for most of them, at the end of the conversation, it is. Some of them, we have other things that we can try. And certainly as erectile dysfunction progresses and Viagra and Cialis are no longer working for that individual, or they are on medicines, have health issues that they can't take those medicines, then I really like it when the partner's involved, because the next steps are choosing injections or a penile implant. And those are really conversations that need to be had as a team. You need to figure out whether you're both on board with that, because that's more invasive. For the penile implant, you're having surgery, you're out of commission for a while. You know, your partner's going to have to help take care of you. The injections can be scary, up front when you don't even know what you're doing. So really having that partner on board, especially once it's more progressive ED, is really important.
That's so helpful, I think, for our listeners to see, first of all, what some of the options are. But let's go back just a second. What are some of the things that you see the spouses, what are they most concerned about with side effects?
The heart, because everybody's heard of, we've watched the movies, we've seen things where, I have to tell them that I took this because I'm having chest pain, I'm having a heart attack. They really want to know, what are the cardiovascular issues? People have heard of blue vision with Viagra. What does that mean? Are they going to see blue forever? Those kinds of things. So they really want to know, is their heart going to be okay? Are their eyes going to be okay? And those are the biggest things, I would say. A lot of guys will get flushing in their cheeks on these medicines. And they want to know, does that mean they're having a heart attack? Is that a bad sign? And so we have to talk through what are actual bad things and what are things that these are typically to be expected. You might have them and they're okay. They're going to wear off as soon as the medicine wears off.
So do you also talk about the side effects of not taking something? something?
Absolutely. And the side effects of not getting regular erections and having that intimacy and that emotional connection. We talk about all of that. And even for my guys too that are earlier in erectile dysfunction, we'll talk about a penile exercise program and how using an external penis pump regularly, almost like you'd go to physical therapy, can help you regain your ability as well. And sometimes they will incorporate that into their sex life and that will be part of it. And some of them look at it more as a physical therapy program and they will do their penis pump exercises on their own, and then they will have sex separately to keep that more of a exercise regimen versus intimacy kind of thing. So it depends on the individual couple, but there's different ways that we can kind of finagle things, get things working for them.
Do you talk at all about the mental health side of him not being able to have an erection and all of the anxiety and all of the maybe even depression? And
yeah, for sure. Granted, my appointments are 15 minutes, so I don't have the time like you do to dive into this. But yeah, I absolutely ask those questions because I need to refer them out because I don't have that quality time. But yes, I certainly start those conversations. Is this affecting your day-to-day life? Is this? And usually by the time they've come to me instead of their primary care, it is affecting their daily life. They are thinking about it all the time. They're having relationship issues. It's consuming them. And so they are depressed. They are frustrated. Their relationship is struggling. I've had guys come in on the brink of divorce. And if we've been able to get their erections better and get the relationship a little bit healthier, we've been able to save the marriage kind of thing. So it really is huge on their life. So I do talk about it, but generally in my quick appointments, I have to do the medicine side of things. I hear what you're saying about the psychological things. Here's a referral and someone that can spend more time with you than I am allowed to.
so on my end, I see a lot of middle-aged women that have husbands who refuse to get help for ED. And there's a lot of frustration there, but they say it's because of shame. If you had a woman come into your office for something else and saw the posters there and just asked a question about it, what would you recommend her approach to be to convince her husband that
To convince her husband.
It's a great question, and you'd be surprised how often it happens.
I'm serious.
It does all the time. Or women who are going through menopause and they're uncomfortable and they're painful, so their husband has given up on trying to have sex with them, and we get that fixed with hormones and stuff, and now all of a sudden they want sex again and their husband's like, I'm good. They'll be like, get my husband on board. So I will say, first of all, bring them in. I'm happy to see them too. I see both males and females. And I have a sex podcast as well. And so I'll hand them my things. Say, here, go check out some episodes on ED.
Between the sheets.
Between the sheets. Yep. And that's a great tool to say, here, just pass them this card. There's some great episodes on there. One of the other things that I'll suggest is just a gentle conversation with him and just say, look, it doesn't bother me. I know it's not me. Let's go get some help. Maybe we can talk to them together. I'll go with you. Making it more of like a partnership thing, that he's not alone. There's not something wrong with him. This is just another hump that we have to get over, just like we had to get over raising kids or we had to get over whatever in our relationship.
You just take a Viagra and you slip it in his hot dog.
Yeah, I feel like that's not ethical. And the other part is I don't give my female patients prescriptions for Viagra. So
That would be a problem.
that would be a little problem. I like where you're thinking.
Jake, I'm just kidding. I would never do that.
Sure, wink.
Here's a question, and maybe this is more a question for Scott than you, because when people come to you, they come a lot of times with that in mind. But how do you feel about patients who say, I have this thing and I need some help? Do you view them as, oh my gosh, he's got this problem?
Oh, heavens no.
Does that happen frequently?
It happens some, but when it does happen, like I allow some sacred space there, and I'm like, I'm really proud of you right now, dude. You're rocking it, because first of all, you're not alone at all, and this happens.
Yeah.
And so I really try to roll out the red carpet for this guy psychologically.
Okay.
When he kind of just moves a little bit, tests out the water a little bit, and when I see where he's going, then I take it and I just open it up. Say, okay, I'm proud of you because this is hard to do, and we can talk about it because this is just life, man. And we want to help you thrive in life.
Yes.
So thank you.
Yeah, I love that, Stephanie.
That's almost exactly the same thing. I'm like, all right, let's talk about it. Tell me, do you have issues getting the erection, maintaining the erections, both? Like, where are you having issues? And breaking that ground, like, okay, this is totally a safe place to talk to me. I deal with this all day long. And one of my favorite sayings to say to my patients is, I play with penis for a living. You're not going to tell me anything that I haven't already heard. This is what I do all day long. I'm not a hooker, but I play with penis for a living legally. So bring it on.
That takes the shame out of it a little bit, I think. The humor part of it, right?
Yeah, it helps to break the ice a lot.
I've never been a woman, never been a wife. Don't have any idea what it's like on that end of the sex. And I think we're getting a little bit bolder saying this because it's just so true. A lot of women don't know what they don't know. They don't know, hey, this could be better. Now, there are those women who think this could be better. And those are the ones like you're talking about. But I'm talking about the other group of women who don't really know that things could be improved. And neither spouse really talks about it. They don't have that space to talk about it. And they don't even know to talk about it.
They don't have the language.
I think perhaps this episode today might be a starting point for those women and men actually who are married, they love each other, they're committed, they're monogamous, and they're in their 40s or 50s or 60s. It's just not, things aren't as hard as they used to be. And if it's gradual, you don't notice it. And so maybe today people can think, okay, let's think about this. Can we improve on this? And I'm not saying everyone should go get on Viagra at all. I'm not saying that. I'm just saying it's a game changer for a lot of people, a lot of marriages, the game changer. So that's all. You have anything?
I think you're right. I think
that?
it is a game changer, and I think it is really important. And one of my favorite things, again, is to just say, hey, go listen to this episode, go watch this, go read this article, and then let's talk about it tonight because this has been on my mind, or I read this really interesting article. Do you want to read it too? And then let's talk about it because it was just really interesting to me and made me question, hey, maybe there's something that we're missing. And especially people who have been with the same person their entire life, and maybe they don't have other sexual experience to have anything to compare it to.
Right.
They think that this is okay. They think this is normal. If you read something and you're like, hey, I kind of want to try that. I think this sounds cool. Whether it's related to ED or not, show it to your partner, talk about it, see. Maybe you just unlocked a new box.
Pandora's box. That's what I call it.
A new delivery box.
A big one. I want to move forward to different types of medicines. There are two main ones I prescribe. The generic, what used to be called Cialis, the generic used to be called Viagra. It's sildenafil and tadalafil. Are there other ones that you prescribe, or you kind of stick with those two, or what?
Yeah, those are my two. I do have probably a handful of guys, maybe 5 or less, that still like Levitra, and they are willing to pay for it. It is very expensive and hard to come by. And I have 2 that are on Stendra. Again, they want to pay for it out of pocket, but I would say the vast majority are on sildenafil or tadalafil. They're dirt cheap now.
$10 for 30 of them or whatever.
Yeah, absolutely. And I always recommend the grocery stores or the big box stores like Costco, BJ's, whatever, because the CVS and Walgreens, they're making their money off of the drugs. They're always going to be slightly higher, even at the cash price. So a lot of my guys who are very financially concerned, I will make those suggestions to them, but they really are pretty cheap at this point. But those are the 2 orals that I go to. I will do cocktails if straight Cialis or straight Viagra aren't working for you. I'll do low dose one, high dose of the other, vice versa.
And why would you do that?
Yeah, so a lot of times I'll do a daily dose of tadalafil, which is Cialis, because it also helps with the prostate. And a lot of my guys are 50s, 60s, and having some peeing issues with their prostate anyway. So we'll do a daily dose of the tadalafil, 5 milligrams, and then I'll give them the 100 milligrams of sildenafil to use on the as-needed basis. It just gives them a little extra push, or we'll flip it and we'll do a 20 milligram dose of sildenafil with a 20 milligram dose of tadalafil on an as-needed basis. And just that little combination sometimes is enough. If they're not quite ready to go to injections next, but a straight dose isn't working anymore, that little extra combination can help.
Yeah, and the tadalafil is a longer acting too, right? It has a longer half-life. So for those guys who want like 2 or 3 days.
Yep.
Without having to take a new one.
A little spontaneity back too, right? And the sildenafil, the Viagra generic, has to be taken on an empty stomach to absorb correctly. A lot of times, sex night is date night, and you don't have an empty stomach, so the tadalafil can come in easier for that too.
Yeah, you're right. The fat really inhibits absorption.
And I'll give my guys some tips to get around that. I say, take it before you go out to dinner, because it's going to last in your system for 4 to 6 hours. You're generally not at dinner for 4 to 6 hours. Take it before you go to dinner. By the time you get home, it's in. Or my favorite suggestion, sex before you go out. Who wants to have sex when you're all full and fat after dinner anyways? So pop your Viagra mid-afternoon, have sex before you go out, then go have date night.
Perfect
I
solution.
like it.
Yeah.
And if you're going to do it after dinner, don't eat a big steak.
Yeah. Or Mexican. Yeah. My partner and I have a no post Mexican rule.
Okay.
Yep.
I like that.
Yep.
So those are all practical tips on this. There's also, I guess, this topical over the counter, which doing some further research, it looks like it's kind of a no-go. on
So
this
it
topical.
depends. I've
Unless
had
you,
mixed clinical results. Exeron is the name of it. You can get it by the condoms and lubes and stuff. Again, it's for early onset. If you're needing oral Viagra, oral Cialis, you're past the point of it working for you. If you're the guy who's just not getting hard enough anymore, not as quite as thick as you used to be, that's when the Exeron is still working pretty well. Or I've also had it work well for my guys with penile prosthesis. Because the prosthesis doesn't go all the way to the tip of the penis, some of them will use it on the glands of the penis, just the very head of the penis, to get that a little bit more engorged. So there's a couple uses I've found for it. But yeah, if you're needing Viagra and Cialis, it's not going to do anything for you.
and is there like side effects? I know there are some rare things like priapism. I've seen priapism. It's you get an erection that's there for multiple hours and doesn't go down. And so then it creates an ischemic that cuts off your blood supply. I don't recommend that.
Yeah, and I always try and stress to my guys, it truly is a medical emergency, and please do not be ashamed or embarrassed to come to the emergency room, because we have a medicine that reverses it, and yet it's can affect your heart and stuff too. So it's not one that we just give you to keep at home. We need to have you on a monitor while we're giving it to you. So please come in. It's a quick, easy fix as long as you come in quickly. If you've let your erection go for 18, 24 hours, you are most likely not going to get erections again in your life. Your dick's not going to fall off, but you're not going to get erections, and you're going to need a penile implant. It is important.
And the other thing, so the one patient I did have, he actually did regain his function. I was sweating bullets there for a little bit. It wasn't for me. But he had an injection. Anyway, it worked out. But that's a scary thing.
It is. And so we generally see the priapisms, which by definition is 100% erection for at least 4 hours, right? I always tell my guys, if you're still 100% erect at 3 hours, get going, because by the time you drive to the emergency room, we get set up and get you the medicine, you're easily at 4 hours or more. But when I see that clinically is young men who don't need it, who try to take it for that extra boost because they heard it works. Men who probably only need a lower dose and try and take a higher dose. Or with the injections, like you said, if they're moving up, because the injections are a titratable dose, it's not one dose fits all. And if they're not happy with the 20 units and they're like, oh, I'm not going to go up slowly like Dr. Steph told me to, I'm going to go ahead and jump to 50 units, they're the ones who end up with a priapism. But if they go up slowly, it generally doesn't happen. But I work in urology. I've seen many priapisms. But if you are careful and go up and use the correct doses and things like that, it's very rare.
And then the very rare, the ischemic optical neuropathy, which is just blindness. Again, very rare, but it's there. It's a thing. It's possible.
It is. I fortunately have never seen any of my patients get that, which is a testament to how rare it is. I have more patients that get blurred vision or see blue for the duration the medicine is in them, but not outside of when they take the medicine.
Good to know.
Okay. So one of the other options for our guys are these injections that I've been mentioning. The most common medication is called Trimix. It's called that because it's actually 3 medications put in one. And the cool thing about these is there's no full body, what we call systemic side effects. All it does is tell your body, hey body, give me blood right here, right now. So we teach the guys to give themselves an injection into their penis with a very, very small needle. I promise it's really not as scary as it sounds, but it's a small amount of medication, and it tells your body, flood me with blood. And so this medicine kicks in within about 10 minutes, and guys get these wonderful erections that last for 30 to 60 minutes, and regardless of climax. So it's a little weird in the sense that, normally when a man has his climax and has an ejaculation, his erection goes down very quickly. This medicine doesn't care about when you climax. It's just going to wear off when it wears off. So that's a little different, which for some of my guys with premature ejaculation, it's a beautiful benefit for them and their partner, but it works really well, and it doesn't have any of the cardiovascular side effects. It doesn't interact with other medications in the same way that the oral meds do. And it can work really well when the oral medications no longer work. So that's kind of a progressive step. And then the final step would be the surgical implant that we can put inside of you. And it's kind of like those old pump up Reebok shoes that we had back in the 80s and 90s. You just pump it up when you're ready to have sex, walk around with a towel on it. I don't care what you do with it. And then when you're done with it, you hit the release valve and it goes back down. So there are really some great options. And especially as my guys get older, they're on more medicines, maybe they've had prostate cancer, things like that. It's really nice to know that there are these other options that you can still have that intimacy with your partner.
That's wonderful medical progression.
Yeah, and the pumps have been around for ages, and I know one of the companies that does a great job with their pump is actually coming out with a Bluetooth model, so you can inflate and deflate from your phone instead of having to pump, which is really great for guys with maybe Parkinson's or dexterity issues. So it's pretty cool. That should be out maybe in the next 5 to 10 years.
And are those expensive expensive as well, or not too bad?
They are, but the nice thing about that is they are covered by insurance. So whatever your surgical split is, the 80-20, 70-30, but the pumps themselves are about 20 to 25,000. So you're still putting out several $1,000s to get that. But we have guys in their 50s that have their prostate removed for cancer. That's a long time to not have sex.
Yeah.
They're taking Medicare out of my paycheck every 2 weeks to fund someone's penile implant pump.
That's right. Doesn't that make you feel good?
How do you feel about that? If it was you, I think you...
Careful, you have a Marriage IQ podcast. You better like that.
That's what I was thinking. If it saves a marriage, right?
No, I think it's great. I just thinking about all this Medicare that I'm paying into, which is fine, whatever. But
hopefully it'll still be there when we need
yeah,
it,
no,
right?
I doubt it.
Might
But
not be.
I think I'd be remiss too if I didn't mention at least some medicines that can lead to erectile dysfunction. And one of the biggest ones are antidepressants.
Yeah.
So SSRIs, that's going to be like the Prozac or fluoxetine or Zoloft, Lexapro.
Which is kind of a problem when we're talking about specifically porn-induced ED, because it does have a high correlation with mental health issues.
Yeah.
Or guys coming back from the military with
Oh, yeah.
PTSD.
Yeah. Yeah.
So
There's a lot.
that's probably one of the biggest ones. I mean, there's some antidepressants that don't affect as much as others. I know some of the newer ones, Trintellix.
What do you find?
I find that not only does it, the SSRIs for sure. I know Wellbutrin is supposed to be less, but I still have guys have issues with that. What I've also noticed is it affects their libido. They don't even desire sex in the same way. And so a lot of times I have them work with their psychiatrist, therapist, whomever, who's prescribing the mental health meds, and we're trying to find a balance of, okay, I'm going to give you ED meds, but maybe we can try one of these other mental health meds that maybe has less side effects with it. But yeah, we see it a lot.
Yeah, and you're right about bupropion. It definitely has less effect on that as far as erectile function and libido. But there are other reasons to put people on SSRIs and not bupropion, and it gets really tricky sometimes.
Yeah.
So to go back to sexual communication and being able to talk about some of these things, we do see benefits for couples who read books about sex. That starts giving them the language to use and expanding their perspective. I think for our listeners, it's important that it's within framework that they feel comfortable with, right? Yeah. Like Scott said, more monogamous sex and just kind of at a level that they're comfortable with, often faith-based even, I would say, but to help them have a language to speak about these things and to make improvements and see what the possibilities are. What would be some of your favorites that you recommend?
I don't have a lot of books. The one I know, Come As You Are, is a great book, just is more female focused.
Nagowski, yeah.
Yeah, that's one of my best books that I like. But I really have found, at least in my demographic of where I treat, podcasts and blogs, YouTube videos, things like that are really a lot more of what I've been promoting to people and sharing, especially depending on what the issue is. If it seems to be more physiological, I'll send them to the ED Cure website, which is put out by Boston Scientific and has some really great information more on the physiological side and the different interventions we have. If it's more on the psychological side, I'm sending podcasts like Marriage IQ or some other ones out there in that regard. Little plug there. So it really kind of depends on where I feel their need is. But I have found that the podcasts and the blogs, because they're shorter, it's easier for them to share with their partner and say, here, watch this on your way to work. Well, please don't watch while you're driving, but listen on your way to work and let's talk about this tonight over dinner because I found this interesting. And that has been more of my go-to than books.
You know what? You're right. You're right. I think I listen to podcasts to learn things quickly if I don't have a lot of time. And I watch YouTube videos as well. So
I think with She Comes First.
Oh yeah, that's a good one.
The Art of Oral Sex, which, I guess there's an art. Who would have thought?
Well, for those of us who have received oral sex, there's an art.
Well, there it is.
Passionate Marriage is one of our favorites.
Yeah, there's several.
And with all these AI things out there too, if you are trying to find the right verbiage, type into ChatGPT, hey, I want to talk to my spouse about our sex life, specifically their erectile issues. Give me 4 examples of questions to start the conversation.
There you go.
That's progressive.
Yeah.
Right.
To start, at least somewhere to start with that.
Absolutely. Absolutely. Because for some people, just saying the words penis and vagina are difficult. Obviously not in my world, but for some people they are. And so maybe you just need AI to give you a question to ask that, okay, and now I can practice it in front of the mirror and I can get used to saying this word out loud, this concept out loud, and then I'm going to be more comfortable to say it to my partner.
She said penis.
Oh no. I love that idea though, because that's really quick. It doesn't take a lot of time. And you're right. You can plan, you can prepare. You don't have to make it through a whole book. You can get just some quick tips with it and be able to have the conversation tonight.
Yeah. And then maybe once you start the conversation, then you go find books that, hey, let's both read these books or whatever. But at least the faster things can kind of get those conversations going for you.
I like it.
Yeah, I do too.
These are good things to think about for our audience today. Maybe things they haven't thought about before or have and wanted further information. If they want further information from you, we mentioned your podcast, Between the Sheets, right?
Yes.
And we're going to be on there.
Yeah.
It is coming.
So that's Apple, Spotify. And then where else? Do you have a website too?
It's betweenthe.sheets.com. So the website's there, which has links to the podcast. We're on YouTube, TikTok, social media, everything that way. But yeah, we have a great plethora of things you want to listen to, things you might not. I know my mother picks and chooses which episodes she listens to. It is not, every episode isn't for everyone, but there is something for everyone is what I like to say.
Well, that's great.
Good. And if they want to see you personally, you're in Maryland, right?
I am. Yes. I practice in Columbia, Maryland with Chesapeake Urology.
Well, thanks for joining us today.
Yes.
Thank you so much. What a great conversation.
This has been so great. I've learned a lot. Scott probably knows a lot of what you were already talking about, but I think it's important to make it accessible for people that don't have the right language to even ask the questions.
Yeah.
So that's really helpful. Well, everybody, thank you for being here. We thank Dr. Stephanie so much for being with us, for sharing her knowledge and wisdom. And we hope that you all have a wonderful week and we'll see you back on another exciting episode of
Marriage IQ.
IQ.